Hello, I'm Michael Fox at JCRM, that's Jacksonville Center for Reproductive Medicine, and I'm a reproductive endocrinologist. Today, in this segment, we wanted to cover for PCOS patients the skin and hair effects and treatment of those in polycystic ovary. So most patients who are considering PCOS as a potential problem or they've been diagnosed with it understand that the skin changes really relate to elevations in male hormones. So we see acne, we see oily skin, we see facial hair, and then we also see scalp hair loss, which is called alopecia and sort of relates to baldness if you think about it that way. So in terms of presentation, a lot of patients will have one or two, maybe not all of those features. Each person reacts differently to male hormones. Each patient has different levels of male hormones, so there may be differences there. And then different races actually have very different changes, such as Asians and American Indians, for example, are going to have much less hirsutism, and so that may not really present much in those situations. But we do have several ways to deal with that. Obviously, if we can treat the whole process, which in other segments you'll see we talk about nutrition is the most important therapy, metformin, maybe hormonal manipulation. All of those things are going to move people in a positive direction with their skin issues. But if that's a primary problem, if brought to us and we get requests for treatment, then we use a drug called flutamide, which actually blocks the male hormone effect in the skin and provides a pretty profound change in a lot of the symptoms. Acne tends to go completely away, and that happens often as quickly as 2 or 3 months. Facial hair and hair in other areas will diminish in the speed with which it grows, the diameter of the hair, and often even the color will fade a little bit. The hair growth may not go completely away though, and so in those patients we would consider, after we get good hormone control, we would recommend either electrolysis or maybe laser therapy to work on that. The alopecia or hair loss, which is very concerning for patients, we would often see that start to reverse some. It definitely will stop. Often though we won't get a lot of regrowth in the scalp hair.